Well, thank you for joining this symposium on climate change, and this talk will be about climate change and air pollution. My name is Alan Lockwood. I'm a past president, a member of the board of directors of Physicians for Social Responsibility, an emeritus professor of neurology at the University at Buffalo, and a member of Ohio Clinicians for Climate Action. I have no conflicts of interest to reveal, and all royalties from any books that I have published go to Physicians for Social Responsibility. I'm going to be talking to you about the links between air pollution, climate change, and health, with an emphasis on particulate matter, particularly the very small particles, the so-called PM 2.5, and ozone, and I'll put some emphasis on wildfires since they have been attracting a lot of attention in the media. I'll talk a bit about formation and sources, effects on health, and actions to mitigate and adapt to this problem. Well, unless you've been asleep, you know that temperatures are increasing, and these are the data for Cleveland, Ohio since 1854 and 2012, and it shows an inexorable increase in temperatures. So here in northeastern Ohio, like the rest of the world, climate change is actually taking place. The debut of concerns about air pollution dates back perhaps to, in the United States, perhaps to 1948, when in October there was an inversion over the town of Donora, Pennsylvania, where there was a steel mill that coated steel products with zinc. And this inversion layer trapped the smoke and pollutants from the mill over the town, killing quite a number of individuals, hospitalizing a huge number of others. And to this day, the remnants of that disaster are still evident in Donora. There's a small smog museum there, which if you're in Donora, is definitely worth going to. And the Donora people like to think that this is the beginning of the emphasis on climate, on air pollution and health. And this is a photograph of one of the infamous fires of the Cuyahoga River. This one occurred on June 25th, 1952. Now, in 1970, during the presidency of Richard Nixon, he proposed that we should start the Environmental Protection Agency. And it started operation on December 2nd of that year with a mission to protect human health and the environment with an adequate margin of safety to protect health. That same year, the Clean Air Act was amended, and it established national ambient air quality standards. These are standards that are set to guide health behaviors and gave the authority to the agency to enact regulations that enable the enforcement and the production of these air quality standards. And I'm going to be focusing on two of these criteria pollutants: particulate matter, particularly that with an aerodynamic diameter of 2.5 microns or less, and ozone. And these two pollutants are responsible for 90% of all of the deaths that are due to air pollution. So hence, it's reasonable to concentrate on them. Now, in 1990, there was another amendment to the Clean Air Act, called variously as the Acid Rain Program, and this empowered the EPA to set limits on the emissions of oxides of sulfur and nitrogen, which were coming predominantly from coal-fired power plants and causing acidification of many of the lakes in the northeastern part of the United States. Now, these compounds are both very chemically reactive, and they react with other elements that are in the atmosphere to produce the so-called secondary particulate matter, in addition to the primary particulate matter, which is formed by combustion, usually of fossil fuels, such as coal, oil, and natural gas. Now, The Lancet, which is a very well-known medical publication, has this group that publishes what they refer to as the Countdown on Health and the Environment. And in 2018, they said that trends in climate change impacts, exposures, and vulnerabilities show an unacceptably high level of risk for the current and future health of populations across the world. Prior to that, they said that climate change presented an opportunity, but now they're saying that it's an unacceptably high level of risk. Now, this somewhat complicated slide shows that the Clean Air Act, particularly the acid rain amendments, are having the desired effect on health. This, on the vertical axis, are annual early deaths, and in this group, due to road pollution, and in the dark blue color, early deaths due to ozone, and the lighter color due to particulate matter. So in this interval between 2005 and 2018, around 10,000 or more premature deaths were being prevented by the acid rain pollution program and the control of emissions from road vehicles, which further emphasizes the importance of the so-called CAFE standards, the corporate annual fuel economy standards. Electric power generation, which had already led to huge decreases in the production of particulates and ozone, continued to have its effect with further emissions on premature mortality. But unfortunately, the commercial and residential sector showed some increases. This is a very complicated sector that contributes to the pollutants. The Excel spreadsheet that goes along with this has over 120 lines, so it's very, very complicated. But the bottom line is that the Clean Air Act was having tangible, positive effects on the health of Americans by reducing mortality and morbidity to the tune of the last estimate published by the EPA of an estimated reduction in total cost to the US economy of somewhere around $2 trillion per year. So this is arguably one of the most important public health measures that's ever been presented. Now, this is an even more complicated slide that's extracted from my book, The Silent Epidemic, which is about coal, and shows how particulate matter affects a huge number of organs. So it's inhaled into the bronchioles and the alveoli. It triggers reflex arcs in the autonomic nervous system that affect blood pressure and heart rhythm, leads to the production of systemic oxidative stress and inflammation. And some of these particulate matter bits get into the bloodstream and circulate around to other organs, so that the grand total effects are protean on various organs throughout the body. It accelerates atherogenesis in blood vessels that go to the heart and to the brain, which cause heart attacks and strokes. It increases clotting, which contributes to those two diseases. Not shown on the slide is the fact that some of these particles go directly into the nervous system through the olfactory bulb and enter the brain, where they can be seen on electron microscopy. And once in the brain, these particles trigger the same kinds of oxidative stress and inflammation, contributing to the overall contribution to the premature deaths from the leading causes of death in the United States of cancer, heart disease, respiratory diseases, stroke, and now increasingly evidence to support type 2 diabetes and degenerative neurological conditions such as Alzheimer's disease. Now, periodically, the EPA is required to reevaluate the National Ambient Air Quality Standards. And this is their assessment of the effects of particulate matter on various domains of health. And the EPA's own estimates say that it's causal for cardiovascular effects, likely to be cause of cancer, likely to be the cause of respiratory diseases, and nervous system diseases, and causes all-cause deaths to increase. Now, in spite of the overwhelming evidence that this is an important cause of disease in the United States, the agency decided in its wisdom that further reductions in the exposure to particulate matter were not warranted, even though none of the published studies in the peer-reviewed literature shows that there is any concentration below which it's safe to be exposed to these particles. Now, one of the things that's happened over the years is that both the assay methods and epidemiological methods have gotten better, so that instead of dealing with long-term exposure over years or months, it's possible to link very short peaks in the exposure to these pollutants, such as particulate matter, to various diseases. And this slide shows a publication from 2012 that shows that a peak in the concentration of small particles that occurs somewhere between 12 and 14 hours before a stroke is linked to the subsequent occurrence of the stroke. And similar data have been shown for myocardial rhythm disturbances, so that in our comments that we submitted to EPA about the particulate matter standard, we urged a further reduction and a revision in the time course over which these effects were looked at. I'm going to talk quite a bit about fires, since that has been in the center of attention. Since 2000, there have been over 73,000 wildfires per year in the United States. And although there has not been very much in terms of the number of fires in the past 30 years, the acreage that's consumed by these fires has nearly doubled since the early 1990s. And it remains true that somewhere around 85 to 90% of these fires are caused by human activities of various kinds. But these fires are exacerbated by climate change. The hotter weather and drought have dried out the forests. They've brought the temperature of the burnable materials closer to the point where they catch on fire. And underlying all of this are invasions of pathogens and insects such as the pine bark beetle, which have killed large numbers of trees in the West, making it a setup for more fires. Now, just this recording is being made the day after Labor Day weekend, and over Labor Day, temperatures topped 120 degrees in some parts of California, and that's a temperature around which it's impossible for humans to survive out of doors. The mechanisms for controlling temperature, such as sweating, fail to keep you cool. And the California fire authorities published these data that said between the beginning of the year and the end of August, there were almost 6,000 wildfires with over 1 million acres burned. And on the radio this morning, I heard that number is up to closer to 2 million acres, which represents about a 50% increase in the number of fires over the average of the past year, and 3 times the number of acres that have been consumed. Now, these fires produce enormous plumes of smoke, as seen from the International Space Station. You can see fires in Southern California, and they have blanketed cities like San Francisco, as shown by these 2 photographs taken 1 week apart towards downtown San Francisco from Alcatraz Island. And you can barely see the outline of the city in the lower portion of this photograph that shows almost complete obscuration. Now, these small particles that are produced and part of the smoke exact a further health toll. Heavy smoke increased the number of asthma emissions as small particle concentrations rose far above the National Ambient Air Quality Standard. They led to increases in hospitalization for asthma, particularly among the elderly. to sadly meet me at the present time. Children aged 0 to 4 years increased by 8.3%. And there was an overall increase between the ages of 20 to 64. There were also increases in hospitalizations for acute bronchitis and chronic obstructive pulmonary disease. Now, these plumes of smoke, which can be seen from the space station, are shown in satellite data extending all the way across the United States, so that the effects of wildfires extend far beyond the people who are trapped and at the present time awaiting evacuation by helicopter from portions in the Creek Fire all across the United States. So with the particulate, there's also ozone that's not shown in that particular photograph. I'll return to ozone again in just a moment. So the estimates for annual mortality due to wildfires are somewhere around 340,000 deaths per year worldwide. So it's a major health problem. I'm going to shift gears and talk a bit about ozone. This is what you learned in high school chemistry, perhaps. Ultraviolet rays from the sun split oxygen molecules that recombine to form molecules of ozone. But the real picture is much, much more complicated. And it involves carbon monoxide, some of which comes from wildfires, volatile organic compounds that are released. Ironically, some of them come from trees. So it's a very, very complicated picture of ozone formation, which is likely to increase in the future as temperatures increase and climate change goes on unabated. Now, in 2020, the integrated science assessment for ozone showed that it was causal for respiratory disease in the short term and likely to be a causal factor for respiratory disease in the long term. It was likely to cause metabolic effects by inhaling a release of stress hormones affecting metabolic systems leading to diabetes, and suggestive for a number of severe adverse health effects. Now, carbon monoxide that's produced by forest fires and a part of that plume that I showed you before are a precursor to the formation of ozone, and this increases after wildfires. So after the wildfires in the summer of 1995, there was between a 10 and 30 part per billion increase in the ozone concentration in the southwestern portions of the United States, also in the southeast. Canadian fires led to increases in ozone concentration in parts of Ireland. And in July and August of 2004, Canadian and Alaskan wildfires led to increases in particulate matter and ozone concentration, particulate matter and carbon monoxide over continental United States and even in Europe. So look at a medical perspective on climate change. In public health, we talk about primary prevention of diseases. So primary prevention for climate change is achieved by reducing greenhouse gas emissions. So it's important to support the EPA and organizations like PSR, Ohio Clinicians for Climate Action, to decarbonize electricity and other elements of society. And your expertise as healthcare professionals and concerned citizens make you highly qualified to discuss this issue. It's important to vote for people who will reduce greenhouse gas emissions. Secondary prevention concerns adaptation to a problem that exists already. And those are things that you can do to reduce your personal carbon footprint, support federal, state, and local efforts to adapt to climate change, lobby your senators and congressmen, and everyone can do something, from doing Meatless Mondays to giving dollars to support organizations that are working to make this a healthier and safer world in which to live. So for further reading, I would suggest the following. You can get weekly updates from the New York Times through Climate Forward, and these publications that will be available when this talk is made available on the internet. So thank you for tuning in, and thank you for your attention.